A Caucasian newborn undergoes an abdominal ultrasound that shows kidneys of normal size, structure, and location. So we're talking about a newborn with normal size, structure, and location. If renal disease is still present in this patient, it would most probably be which of the following? And there's 5 options. So choice A says autosomal recessive polycystic kidney disease. Autosomal recessive diseases present at birth during the first few years of life, and they have bilateral flank masses, and cysts are formed from the dilated tubules and collecting ducts. So they're going to present at birth. So there's no possibility that they're going to have normal size, structure, and location. So the ultrasonography was not going to be normal. So choice A is not the answer. Choice B, adult dominant polycystic renal disease. Now, adult dominant polycystic renal disease does not present at birth. But do they have cysts at birth? Sure they do. It's just they're not big enough to be seen under the ultrasonography. So they're going to look normal at birth because the cysts are tiny. As they grow older, those cysts will enlarge, and we're going to be seeing the cysts later in life. So in this case, B seems to be a viable choice, right? Because we won't be seeing anything at birth. Size, structure, and location is going to be just fine. Cystic renal dysplasia. With cystic renal dysplasia, there's going to be multiple cysts of varying sizes in the kidney, and in fact this is going to be seen in newborns, and the ultrasound is diagnostic for this disease. So choice C is not a viable answer as well. Horseshoe kidney and Potter syndrome, they do not have normal structure and size and location, so those two are automatically ruled out. So the best answer in this case is going to be adult dominant polycystic renal disease. They're going to have a normal kidney at birth, but later on in life they're going to have problems. I want to take this opportunity to talk a little bit more about cystic renal dysplasia. With cystic renal dysplasia, there is going to be a problem with the utero and the pelvis junction. The uteropelvis or the pelvocalceal junction is going to be there's going to be atresia, and the kidney that is affected by cystic renal dysplasia is going to be non-functional. The other examples, horseshoe kidney, the poles are going to be attached. The poles of the kidneys are going to be attached to each other, giving them a horseshoe appearance. We know that one. So they're obviously not going to have normal size or structure or location. The normal structure is going to be defected. Potter syndrome happens due to renal agenesis, due to oligohydramnia, due to renal polycystic, infantile renal polycystic kidney disease. The infantile kidney disease also can cause oligohydramnias, which can give rise to Potter syndrome. Many things can give rise to Potter syndrome, right? But anyways, for this particular question, since the patient does not have any kind of manifestation as a child, it's probably autosomal dominant polycystic renal disease, where the cysts are so small that they're not visible at birth.